Welcome today to the NHCC Educational Committee Roundtable Forum on Cannabis 101, where we bring medical professionals together to demystify the health and wellness power of cannabis to help break down the Latinx community's long-held cultural taboos and beliefs on cannabis. My name is David Sanchez, board member of the National Hispanic Cannabis Council and Cresco Labs' VP of Product Development. Today, we're here with our two other NHCC Board of Directors, Dr. Phil Burns and Dr. Craig Ontel from New York State of Mind. Welcome, guys. Thank you for joining us.
Thank you for having us.
And I'm your host, David Sanchez. A little introduction about myself. I've been with the NHCC since the inception in March of 2021, where we really thought it'd be great to come out and provide educational pieces and content to the Hispanic community. And this is one of our forums. And so I'm excited to bring this information to you guys as well. Joining me today is Dr. Craig. And Craig actually trained at NYU's Rusk Institute of Rehabilitation. From there, Craig nearly spent 15 years of private practice in NYC, where he also served as the director of the Ambulatory Orthopedic Rehabilitation Hospital at NYU Langone. In May of 2021, he left NYU to become CEO's State of Mind Cannabis. Welcome, Dr. Craig.
Thank you. Thank you for having me this morning.
Yeah, and our other guest speaker for today, Dr. Phil Burns, doctor of osteopathic medicine. He's been practicing for 20 years, where he's actually also completed specialty training in the field of physical medicine and rehabilitation at NYU Langone's Health Rusk Institute of Rehabilitation Medicine. Upon completion of that training, he founded and has operated a successful medical practice based on a patient-first principle. He specializes in orthopedic rehabilitation and prosthetics, where Dr. Phil Burns has participated in academic rounds on the Neurological Rehabilitation Service for many years as an assistant clinical professor at NYU Langone's Health. Dr. Burns is driven by his desire to make a meaningful impact in the state's opioid crisis. Welcome, Dr. Burns.
Thank you for having me.
All right. So today's NHCC Educational Committee Roundtable on Cannabis 101. The intent for this session is to provide an informative overview on methods of consumption. That's our topic for today. So before we start into our discussion today, I'd like to say a few words on the National Hispanic Cannabis Council's mission, which is to educate the U.S. Hispanic community on the health and wellness power, as well as the economic aspects of cannabis to empower their support and participation in the industry. It is also our mission to help demystify the plant through educational programs such as this one, and to promote the health and wellness power of cannabis, and to break down those long-held cultural taboos and beliefs on cannabis. So with that, I think we can dive right into our topic of conversation for today, which is methods of consumption. So let's start at a high level. Guys, what are the different types of cannabis consumption?
I love this question. And this is when we meet with patients, this is where we typically spend, a good 10 or 15 minutes going over different methods of consumption. And the different methods are inhalation, oral, or topical. Those are the three main ways that we would use a cannabis product. And it really depends on what your patient needs and who your patient is. Some patients need an immediate response from the medicine. Some patients are looking for a delayed response. Some patients are looking for a long duration of response and some for a short duration of response. All of this needs to be taken into account when you're discussing methods of utilization with a patient. We also need to be cognizant. Some people cannot inhale a cannabis product or any other smoke. Some people have an allergy, a skin allergy to some of the lotions and creams that are out there. And most importantly, everyone's endocannabinoid system is different. And its variables are weight, gender, consumption frequency of cannabis, and overall metabolism. All of this plays a factor when we're discussing with a patient different methodologies for using cannabis.
Awesome. And what do you think some of the biggest misconceptions are with consumption of cannabis?
Some of the biggest misconceptions are, the biggest thing that I hear is I'm going to overdose, and I'm worried about taking too much product and sometimes the counter of too little product. I'll start at the highest of levels. Cannabis is non-toxic, and there have been no reported deaths due to cannabis. So we can get that right out of the way here. And I let patients know that right off the bat. Do not worry about that. However, I also let them know that too much cannabis can lead to some elevated paranoia, some anxiety, and the patient may themselves feel overwhelmed. It's really all comes down to dose. And what's the definition of a dose? The definition of a dose is a measured amount of a medicine or a drug intended to be taken at one time for a specific purpose. And as long as we're able to figure out the appropriate dose for the patient, we will likely get the appropriate desired response.
That's interesting. So when we talk about dose, how is a dose determined with a patient?
Great question. And that's a harder one to answer. So I'll start with flower. So flower is inhalation. And, for reference, we're talking about maybe someone has a joint, which is a cigarette roll, or a blunt, which is a cigar roll, or a dry pipe or a water pipe. Those are all ways that people consume flower. And that's actually the most popular form of cannabis use is flower. Now, the caveat with this is a live produce. And you have to be careful, not so much careful, but you want to look for consistency. And what I mean by that is if you're going to be using a flower-based product, you want to try to obtain that product from the same grower. They have the same operation. They're growing it in a similar way, drying it in a similar way. So the consistency will be closest, but it will never be exact from one harvest to a next.
That's interesting, and very good points on sourcing your cannabis from a consistent source, known provider. All very good points when purchasing or looking for product. You mentioned that the multiple ways of consuming cannabis. What are the most effective? And
so it really depends on the
So
it depends on the patient for effectiveness. If someone's looking for an immediate response, flower or inhalation is best. And with flower or inhalation, you pretty much have an immediate response into the lungs, through the blood-brain barrier. The benefit will last for a few hours, and then the patient might be looking to take more of their medication or some additional product. Then we have concentrates out there, and concentrates are substances where the more desirable properties of the cannabis, for example, the cannabinoids and the terpenes, have been isolated. And when we talk about a concentrate, we have two different types of concentrates. We have a non-active concentrate, which needs to be heated. That's something that would go into a vape pen or a vaporizer type of device. And then we have active concentrates, which go into your edibles, your tinctures, which are drops that go underneath the tongue, or your topical solutions. When we are speaking about a vape pen or an an inactive concentrate, the product is placed into the device and it is heated to approximately 350 degrees Fahrenheit. That's a lesser temperature than what would obtain if they were actually smoking the flower product. Less of the tar and less of the chemicals get released into the lungs. So vaping in and of itself should be a less intrusive method of consuming cannabis. You're still smoking regardless. As far as dosing goes, it's very important if someone is inhaling flower, i.e. smoking a joint or a pipe or something, they do not hold it in their lungs. And this is a major misconception I hear from patients all the time. 95% of the THC is released within the first few seconds. So you do not need to hold this in. You should inhale and exhale fairly quickly. Edibles, which I spoke about a minute ago, edibles have a much longer delay of onset. And they last a lot longer too. So what happens with edibles, and we hear this often from patients, is someone gave them a brownie or a cookie, open, close quotes, and it was too much. And it lasted all day long, and it really never, 8 hours later, they were still feeling something, and they don't want that to happen again. And it really comes down to an education for the patient. What happens when we ingest this, it goes into the stomach, and it gets metabolized in the liver. So further broken down into the liver, actually into a more potent form of THC that lasts longer. So need to be a little cautious with the edible route, and they also tend to be a little bit more sedating. Topicals, lotions, creams, they're great if you have an isolated issue, meaning you have a knee that's arthritic or swollen or painful. You would apply that topical product right to that swollen joint. You are not getting any cognitive effect at all off of a topical. So when our patients come in who are very sensitive to every medicine they ever take, and they have a small isolated condition, we'll use a topical. Now, patients need to be careful with this. It is very difficult in medicine for us to create a product that effectively penetrates through the skin barrier. Got it? So I was going to mention this before. You must always source your product from a reputable, licensed company, whether it's a topical, especially if it's a vape pen, and Dr. Burns is going to get into that in a minute, or any type of cannabis flower. Please do not step outside of a regulated business.
All very good points to hear, and for the folks listening in, couldn't agree more. Oh, so important. And Dr. Burns, did you have some notes on vapes?
Yeah, so I was going to get into the vape crisis, which obviously took the country in 2019, pre-COVID. There was a sudden outbreak of lung injury and even deaths. By 2020, about 60 people had expired and 3,000 people were hospitalized. When the CDC looked into it, they looked at as a contributing agent or a cause was vitamin E oil, which was basically used as a thickening agent for the concentrate. So basically, in the production of a vape product, they take a super concentrated THC, CBD product, they thin it out, add additives, and then have to thicken it back up. And the vitamin E oil was used for that. And as that oil gets into the lungs, it's the alveolar where the oxygen is exchanged, It can produce a lipid pneumonia similar to a bacterial pneumonia or a viral pneumonia, which can cause, obviously a temporary issue or even lung damage. As they looked at this more, though, they realized that there was some burning within the lungs, and it looked like there was more than one agent that was contributory in this. And a lot of the flavoring products that were, although FDA approved for oral consumption, weren't that safe when they were burned and inhaled. So it looks like there was sort of a multifactorial approach that led to these lung issues. We also noted that the majority of these cases were occurring in places where, as Dr. Antel was alluding to, the market was sort of unregulated. People weren't buying from reputable companies that were doing the testing on their product, that were using only sort of the best standards of production and the best products to go into them. And vape products are safe when purchased from a reputable manufacturer and reputable dispensary. But all of this obviously goes with, sort of you having a conversation with your healthcare provider and determining what route is best for you for your particular condition, and obviously your other sort of associated or non-associated medical conditions and comorbidities.
That's interesting. And yeah, being in the industry, definitely remember the vape crisis and what that meant for consumers out there. And I think there was a lot of speculation on what products can I have confidence in, and what products should I be buying? Should I just omit this category already? Dr. Craig, you did a great job identifying and shouting out sometimes the onset and how quickly you get those effects are what people are looking for. And vaporization is a quick onset that sometimes if someone has trouble sleeping, wakes up in the middle of the night, they want something that's going to act fast, right? So I think it's definitely, people want to use these products. They have concerns about how they're going to feel if the product is dangerous. And Dr. Burns, thank you for those notes. I mean, it's oh so important, and I appreciate you guys talking about that. I think one thing that also comes to mind when thinking about consumption is bioavailability, and are we getting everything that is in the product? And how does that differ across those methods of consumption?
Yeah, I can, I'm happy to go and speak to that. But before I hop into that one, I just wanted to touch on another method of consumption or use, which is the tincture.
Oh, yeah.
And a tincture, alcohol based, and it's absorbed sublingually or underneath the tongue. And the patient puts a few drops underneath their tongue, and it works fairly rapidly within a few minutes. And then they swallow the rest of the product. Now, the initial tincture use underneath the tongue is more of an immediate effect. The swallowed product, though, that's a delayed effect. So a tincture is another route that we use in patients who cannot smoke or prefer not to smoke. And we're seeing excellent results with tincture-based products as well. As far as dosing goes, I touched on it with the flower a little bit, but where it really comes into play is in these more specifically metered applications, like an edible, where we know the exact milligram concentration, or in a tincture where we know it to the milliliters. A rule of thumb is start low and gradually increase. We always have to take a look at to whether or not the patient is native to endocannabinoids, meaning do you smoke or not? And if someone does not use a cannabis product and is not experienced in it, we start them at a very low THC and a higher open quote CBD concentration. And then if necessary, we ramp them up a little bit. As far as the milligram doses go for the edibles, we start them at 5 milligrams or even 2.5 milligrams. We have them try the product and wait 24 hours for feedback. If they need to increase, we increase them by 2.5 milligrams at a time until we get to where we need to be. Rarely we're ever going above 10 though. So I just wanted to touch on that for a minute because that's something that I did not mention before. And can you repeat the other question, David, just because I hopped off topic? Sorry.
No, I mean, these are all great insights. Definitely don't want to miss tinctures from the conversation. Also a very good method of consumption. But the question was, how does the bioavailability really differ from product to product and method of consumption? I think oftentimes folks think that they're getting everything. Is that the case?
No. So to get everything, you want it all.
You want it all.
Want it all, it's smoking flower. So if you're smoking flower and whether it's in a cigarette type style or in a pipe type style, that product decarboxylates. That's how it breaks down and everything gets released at once. So you get the THC, you get the CBD, those 100+ breakdown products. Here they all are at once. You get everything. The opposite end of that spectrum would be your topical, where it's isolated to a knee or a hand or a shoulder or a wrist. And that person is just applying that lotion, that cream or whatever right to that area. That has the least amount of bioavailability or absorption in the body. And then we're going to go in the middle or in between those two. So I mentioned that concentrates are concentrates. So they take some of the terpenes and some of the cannabinoids and they concentrate them down and they're heated up in that vape device, which does not completely decarboxylate them. It's not hot enough. So they do get less benefit or less of a response from that, or less of an exposure, we'll say, not response. And then a little bit below that is the ingestibles. So whether it's a brownie or a cookie or something along those lines. And that really depends upon the person's GI tract and their absorption.
So if someone is looking to maximize the bioavailability of the product, then you're saying flour would be the best bet?
Flour would give you the maximum bioavailability of the product, taking into account you're getting everything. So if someone is really looking for a certain terpene profile or certain specificity or specifics out of the product, they're not going to find that in flour because everything gets released at once.
Got it. And another method of consumption, just switching gears here, is suppositories.
Suppositories, absolutely. I can look you all in the eye here and frankly say in the 5 years I've been a cannabis prescriber in New York, I haven't written one, no one's asked. But as a physician, I know a lot of folks cannot take any medicine orally. They just can't for medical conditions and they can't use topicals. And that's where a suppository would come into play. And the availability would likely be similar to that of an ingestible.
Interesting to hear that nobody's asked for it. I think oftentimes in my world, people ask, is suppositories the next, big thing?
Speaking of the next,
glad to hear the demand is.
Speaking of the next big thing, if you were to ask me, I tell you it's beverages.
Yeah.
And that's one thing we didn't discuss yet, but beverages work great as far as immediate availability. And beverage, your consumer takes it, they feel the effect relatively quickly. It lasts for a few hours, and beverages, we get a lot of positive feedback on. And
And you think that's
it's an
just,
easy method.
yeah, do you think that's just from the familiarity that people have drinking something like that, or maybe like a syrup kind of NyQuil kind of deal?
It's part of the familiarity, absolutely. And it's more just the ease. There's no social stigma to taking a beverage. No one's looking at you. You're not, smoking something. You're literally just having a beverage.
Interesting. And have you guys heard of like the fast onset technology and how nano emulsifications help increase the bioavailability and decrease the onset time so you're able to consume and feel the effects faster? I think we're seeing a lot of this technology touted in the beverage space in terms of trying to make the experience more sessionable, where it's not like you're drinking a beer next to your buddy if you're having a cannabis beverage, but yours takes 3 times as long to take into effect, right? And so I think we're seeing some of this technology in that beverage category. What do you think about some of that technology? Is it positive? Is it needed? What kind of effects can we expect there?
It's positive and it's needed. And as that technology becomes standardized, is the word I want to use, and more widely accepted, and there's right now there's a handful of companies out there that are pushing this forward. And there's a lot of manufacturers that are claiming they're using nanotechnology plus minus. So as this field matures, absolutely. And it's really about the speed of delivery of the product. And if nanotechnology is able to make that frame smaller or expand it out and make it compatible to other methods of delivery, folks will continue to pursue the nanotechnology.
Yeah, it's amazing. I think that there's definitely some legs there. I think we have yet to see that standardized perspective on the products, but definitely excited to see some of that. And one thing that I really enjoyed you highlighting is the extended release options as well. I think oftentimes we quickly go to like how quickly can we feel the effects, but I think that there's another market saying like how can we extend the release? How can we make sure that we feel the effects throughout the night or throughout, etc. So, what kind of experience do you guys have with extended release products? And is there a need for that via cannabis therapies?
Yeah, so that's always, a difficult thing, but a fun thing for us in the office, because you have your patient who wakes up in the morning and, sometimes they're in need of their product right there and they can't lay around in bed for an hour and wait. So you have to address that. So usually what we do is we don't just have one formulation of cannabis. We use 2 or 3. So what we'll do for our patients who wake up in pain or in discomfort or in distress or whatever it is, we'll have them start their morning either with a vape pen, smoking, or even a tincture that goes underneath the tongue. The reason for that is they're going to get that fairly immediate relief. Then we tell them as that starts to wear off, which we know it will within a few hours, we typically transition them to either a pill form, which we didn't discuss, or some type of longer lasting edible that'll give them enough time during the day to get them to the back end of the day. We prefer to use the pill form over the edible because we have more control over the timing with the pill form, and the pill form is not going to break down into that more potent THC and be more sedating. So we start them off with something that's immediate acting. We have them long acting during the day. And then on the back end of the day, we move them to shorter acting again. Typically, if the consumer has had some THC or some cannabis product in them during the day, their sleep tends to be better at night.
Mm-hmm. That's so interesting. I think I don't know why I hadn't thought that people could be using multiple types of products as their baseline. Um, but I think that's very analogous to other medications.
Yeah, because our goal for the daytime is to have people at work and
Yeah.
functional.
Yeah.
Like we don't want you sitting there crashing the stock market and doing things because you're not focused. So by having them at a low THC pill and a higher CBD, we tend to not affect them cognitively at all, but they're getting the relief from the medicine they need for their pain, their inflammation, their anxiety, whatever the cause is. And we're getting great results with daytime use. We are.
That's awesome. I wanted to double click on the pills conversation. And can you talk to us about the differences between tablets and capsules? Is one better than the other? What kind of experience do you guys have there?
It's not a better or a worse. It's different. It's like vanilla ice cream or chocolate ice cream. They're both ice cream. Got it? So, a capsule and a tablet, all of these things have a coating on them. And the coating is really kind of what dictates how that medication is released. So there's extended release medication where that coating takes hours to break down in the GI tract. There's immediate release medicine where that coating breaks down immediately. So it's more of, when you're talking capsule versus tablet, it's more of patient preference. And sometimes someone will come in, they're like, I can't take that horse pill, or I can't take a capsule. It's more personal preference as opposed to, the effect you'll get.
Interesting. What other consumption questions do we have?
Well, I think I would just add it's sometimes diagnosis specific. So if you're treating nausea, giving something oral might not be the best route. If you're treating anxiety, you want something that will act more quickly. If you're treating sort of chronic pain, you want something that's sort of slow and low and consistent. And then other diagnoses the patient may have. So if someone has COPD or asthma, inhalation might not be the best route. Or if someone has, pick another diagnosis,
No, Dr. Burns, those are all very great things to consider. Definitely nothing that comes to my mind when I'm thinking of this topic. But as a follow-up question, and I think a question that our viewers are really interested in is, let's talk about our children. And I think the Latinx community often sees the best efficacy, or the best, not sees, but I think the Hispanic and Latinx community have this perception in a positive way when cannabis is able to help children, infants, but there is the taboo there of, but how can we make sure that we're giving them the right method of consumption? What are some of the considerations that you would take when prescribing something to maybe someone who's under the age of 18?
Personally, I would avoid all inhalation methods. It's smoking's not good, period. It's just not, no matter what we're smoking, and whether we're vaping or whether we're smoking a cigarette or, anything tobacco or cannabis related. So, as a parent and a physician, no. I would certainly go more, the pill form or the edible form with children, and likely more pill than edible even, just because it is more of a traditional open quotes, close quotes medication. There's no social stigma associated with taking a pill usually, and no one knows what's in that pill. So it's not like your neighbor thinking that you're taking a cannabis pill. And we're also able to fine tune what's in the pill. So, if we're talking seizures or something, God forbid, like, we can really fine tune the pill to what we need. So pill form is best for that.
Awesome. Thank you. And the reason I thought of that was coming from Colorado. I think one of the big stories that we saw was the efficacy with Charlotte's Web, an 18-to-1 ratio strain, where Charlotte, the young girl, was taking, I believe, a tincture application,
Tincture.
and we
Yeah.
saw great results with her story. But yeah, just wanted to share that and maybe bring that to light for anybody who's listening or watching.
Absolutely. And Charlotte's Web was huge, and tinctures a lot of folks use as well. And I'd put that right there with the pill form. I would. It's yes.
What about methods of consumption to stay away from if you are wanting something or a specific effect?
You know, my advice to everyone always is be smart, and respect your body and be smart. And when we talk about methods of consumption, and Dr. Burns mentioned this before, you need to be very careful what you put in your body. And you must go to a regulated, tested, licensed store to buy your cannabis products. Because the reality is, stuff that's not coming from those stores is not tested, it's not regulated. It could be sprayed with carcinogens. The vape pens you buy could be made with inferior products that are going to leach metals into your lungs, etc. So less is more, dosing wise, like I said before, and be smart and safe and stay within the lanes, and you'll be fine.
Great advice. Great advice.
And my last parting word with that is, because patients, I see this all the time, and I'll use, Advil, for example, that they took 8 Advils because they thought it would be better than 6. At a certain point, it doesn't make much of a difference anymore making you feel better. You're just going to hurt yourself. Yeah. Same thing with cannabis here. So, use what's prescribed, but don't go way above and beyond, because you're not going to get any additional benefit that you're looking for.
Very well said.
Thank you.
All right.
Any other consumption method questions? And, David, just for everyone who's watching this, and Dr. Burns, and, anyone who goes to a dispensary, every time you go, there's more products. Yeah. And there's more things to choose from, and there's more delivery methods. And this is going to continue to evolve. And there's powders that people are putting in drinks now, etc. So what we discussed today, safety-wise, is going to carry through to when we redo this again in a year. But when we sit down again in a year, we're going to have probably some additional delivery methods and products that we'll be discussing, just because this industry is moving that quick.
Dr. Greg, Dr. Burns, thank you guys for joining us today. Very great insights and great discussion for our viewers today. I think what you guys helped us understand, methods of consumption, how those differ. We highlighted the importance of dosing. We highlighted the importance of therapeutic effects and toxicity. You're not really going to feel much better if you overdo it. And I think we had a great length of conversation on the safety of and protecting the consumer, purchasing from reputable companies, purchasing well-tested products that have gone through the ranks is also important. So thank you guys so much for joining us today. Thank you for all of our viewers and listeners for joining the NHCC forum of Cannabis 101, where we bring these educational topics to the front of the line. So have fun, be safe, and stay well.
Thank you.
Thank you.
Thank you, guys.